Good afternoon, everyone, and welcome to SBB Live. We have some special guests here with us today, and we would like to give a shout out and a thank you to Jennifer Hoops over at the beautiful Arbor Trace. We are actually in the penthouse suite. Maybe we'll be able to give you a tour in a little bit as well. But without further ado, I definitely want to introduce our panelist for today, Adam Corcoran with Homecare. You want to tell them a little bit about yourself, Adam?
Sure. As Amanda said, I'm Adam Corcoran. I'm the Director of Business Development for Homecare. We are a private duty home care agency that serves Lee and Collier County.
All right, awesome. And Lindsey Turnbaugh with Preferred Home Care. Want to tell us a little bit about yourself?
Sure. I'm from Preferred Care Home Health. We are a Medicare certified home health care agency, and we service Lee and Collier County as well.
Fantastic. And our main topic today is to discuss the differences between home care and home health. Being in the industry for a while, I'm sure we can all agree that there's a lot of misconceptions between the two, and the terminology is a little confusing. So Lindsey's joining us here to talk about the home health care side of things. Do you want to give us a brief overview on the differences, Lindsey?
Sure. So, like I said, I work for a Medicare certified home health care agency. That means that all of the services that we provide to our patients are covered by either their traditional Medicare or their Medicare replacement policy. Those services are the skilled services that are required in the home, and those, in order to have those services covered by your insurance, insurance requires a couple things, and that's an order from your physician, a copy of a progress note from a time you've actually seen the physician for what we're treating. We also have to be a network with your insurance. Traditional Medicare covers the services 100%, and then it has to be a taxing effort to leave the home. One other thing that insurance requires is that when we come out to the home, we have to be providing a skilled service, and we have to show progress with each visit. So that's kind of a general overview of home health care and the services that are covered by Medicare.
Perfect. Great explanation, Lindsey. Thank you so much. And I know that you work hand in hand with your sister company over here, Homecare. So, Adam, how do you guys fill in the gaps when it comes to home care versus the home health portion?
Right, so private duty home care services is a little bit different. It's non-medical in nature, right? So as home health services, you would expect clinicians to come to your home. In a home care setting, you'd be having support through a home health aide or a certified nursing assistant. And some of the services that would be allowed to have through home care would be like cooking, cleaning, hands-on support with helping with bathing and transferring and exercise support, or even just transportation services to your doctor's appointments. So although it's not covered by your Medicare insurance, we are typically privately paid or paid through a long-term care insurance benefit. Home health and home care work in conjunction in many cases because people prefer to age in place and live at home as long as possible, so they can have the clinical support and also have non-medical care to kind of fill in the gaps.
Fantastic. Now, Lindsey, you mentioned a word that I think is unfamiliar sometimes to seniors. Give us an explanation of what homebound really means.
Yeah, so I think sometimes people get confused with homebound and bedbound. Just because you leave your home for basic day-to-day tasks doesn't mean that you're not homebound. Medicare actually allows you to leave the home to go to doctor's appointments, to go to the grocery store, you're allowed to go to church, get your hair done. But if you're going out golfing, cruising, shopping, then Medicare looks at that and says that it's okay for you to go to those services or receive the services, whether it be wound care or therapy, on an outpatient basis. It just has to be a taxing effort to leave the home.
Great explanation. Adam, give us an example of how using a home care agency in general can help you remain independent and, as you said, stay in your home and age in place, because it's statistically about 90% of us want to stay in our home and age in place.
That's right. So, and in a lot of cases, family is unable to support with activities of daily living. So whether that is the personal care services or even just maintaining safety in the home, in many cases families have to look at professional help to come in and support. So whether it's a couple hours a day or around the clock, our teams can come in and really ensure safety to make sure that people can live at home, the comfort of their own home, as long as possible.
Great. Of your services?
So, I mean, I think, we could probably talk through what a typical scenario would look like. In my opinion, we typically see a lot of people coming out of the hospital or a skilled nursing facility. And a lot of people have a little confused of what's going to be covered by Medicare, what's not. So maybe Lindsey can kind of start off with explaining a little bit about that timeline of events of when you are coming out of a hospital or skilled nursing facility, what to expect if you're being ordered home health.
Yeah, so we service or provide services to a variety of different diagnoses. A lot of times we'll see patients, like Adam mentioned, right after rehab or a discharge from the hospital. So just to pick a common one that we see, we do a lot of post-surgical patients. So after surgery, you'll be discharged from the hospital, and usually you have a protocol from your physician that outlines what type of therapy and therapy goals they want for you, and then you might have incision care and the nurse coming out to make sure, monitor signs and symptoms of infection. Those are the services that are going to be covered by your traditional Medicare. We come out to the home, we have an order to be there, we're providing a skilled service, and we're able to monitor that progress. We're able to watch you progress in either your therapy or make sure that the incision is healing properly. And then home care will fill in the gaps with what else is needed. So usually after surgery, you're still going to have a difficult time getting up in and out of bed or getting to and from the hospital. So Adam can go into how we work together in a situation like that.
Because in most cases, a clinician, whether it's a registered nurse, LPN, therapist, is going to come for visits. And visits typically are between 45 minutes to an hour. Now, if someone's not ambulatory at all and is having a lot of difficulty and no one living at home, most likely they're going to need some support more frequently.
Making their meals, helping them get to and from the bathroom, things of that nature, right?
Correct. So that's where home care can come in and fill the gaps and be there more on an hourly basis to ensure that safety, especially with the high risk of coming out of a surgery or a hospitalization.
And one thing to keep in mind too is with home health, usually when I'm working with patients, they might give me a preference in time and when they want a clinician to be out there, whether they prefer mornings or they prefer afternoons. But due to time sensitive appointments from other patients, we can't guarantee the same time every single day. So you might have a nurse that comes between 11 and 12 or between 1 and 2 to provide your services. But if the spouse or caregiver has to go to work after a couple days, who's going to be there to take care of those other times? So that's where home care really works perfectly, because they'll come in for 4, 5 hour, 6 hour blocks to bridge that gap to make sure nothing happens.
And Lindsey, how long would you say that a typical home health care agency is in the home after a surgery while you're waiting for that skill to get better?
So just to explain kind of how the length of care for home health care works, when we are creating our care plan for our patients, Medicare likes us to work in what are called episodes. So we have 60 days that we have to report of what our care plan looks like. That being said, we also take into consideration the physician's protocols. So say for ortho patients, we might only be in the home for 2 weeks, because after that, patients are ready to go to outpatient services. If it's out of a rehab facility, we might be coming in providing therapy 3 times a week until patients are ready to go to outpatient. It just is all based on the patient, and we create specific care plans. It could be a couple weeks, it could be up to the 60 days. When the clinicians come out to the home for the first time, they're going to assess what those physician orders are, where you were prior to your hospitalization, and what your goals are, and then they'll create the care plan. They might be coming out a few times a week for 4 weeks, for 6 weeks, and if we reach those goals before that period is set, we discharge early. If that 60-day episode comes up and we are still able to show progress and there's more therapy needed, we can always extend. So it's really specific to each patient.
Perfect. And you kind of started to address my second question for Adam. Can you tell us what a care plan is and how a company like yours makes sure that they're following that care plan?
Right, so our care plans probably look a little bit different. Obviously, in a home health arena, it's more so clinical. From a private duty home care perspective, a company like Golden Care would go into the home and do an evaluation to understand a little bit more about what the day-to-day needs are. And then we map out understanding what the tasks would be, and then we work with our teams to identify who would be a good fit. Being a state licensed agency, we have a ton of employees but it's not cookie cutter, right? We can't just put a warm body in a home. So we have to go back to the drawing board with our team to identify who has the strengths to fit that the care needs.
And would you say one of your biggest challenges is people waiting to the last minute to give you a call to create that care plan?
Absolutely. And that's typically what we see is people are acting in crisis matter. So Golden Care, we strive to educate people to be preventative and proactive when it comes to planning. And what that looks like is that, maybe before you have an urgent need, start having conversations with a reputable company and building that relationship, because it's crucial. No one wants to wait till Friday at 5 o'clock when you're being discharged from the hospital to have to coordinate care. So having a plan in place prior to those crises is better for everyone, the family, the patient, and the agency that you're using.
Perfect. You want to tell our viewers today how they can get in touch with you?
Yeah, so like mentioned earlier, I work for Preferred Care Home Health. Our office is you're more than welcome to call if you have any questions or want us to come out and see if there's any way we can help you. Our phone number is 239-262-2400.
And you can find them on the cover of Seniors Blue Book.
Yes.
That's right. And for Golden Care, you can reach us 24/7 at 239-440-2900 or us online at goldencarefl.com.
Perfect.
And we're also going to, Adam and I partner to do a more in-depth presentation on this, and we go into even more scenarios and a question and answer. We're doing our next one here at Arbor Trace on Tuesday at 2 o'clock. So if you'd like to learn a little bit more, please feel free to come out.
Awesome. Thank you guys so much for joining us for SBB Live. Have a great day.